Thanks, Tyler. In tonight's Health View, a warning for any woman trying to get pregnant, and it involves something you can buy right over the counter.
That's right. A new study shows that anti-inflammatory pain medications can impact your fertility. Over-the-counter pain relievers, including Aleve, Motrin, and Advil, either contain naproxen or ibuprofen. Both are non-steroidal anti-inflammatory drugs that a new study says can prevent ovulation.
So early in the menstrual cycle, when women are having cramping and they can have some pain, they obviously will want to take some pain medication to relieve the pain.
But beware, says Shahryar Kavusi, a reproductive endocrinologist at St. David South. He says the study showed in as few as 10 days, over-the-counter anti-inflammatories negatively impacted a woman's chances of getting pregnant.
So they compared women who took these non-steroidal anti-inflammatory drugs versus ones who didn't, and the ones who didn't, 100% of them actually ovulated like they normally would. And the ones who did take these medicines, depending on the medicine, had a 25 to 75% reduction in ovulation rate.
Kavusi says the anti-inflammatory medications delay or rupture a key ingredient in the follicle, the fluid collection that contains a woman's eggs. He says his patients, already well versed on what can negatively impact fertility, are still stunned when they learn the study's findings. It surprised women we ran into on the hike and bike trail as well.
I take Aleve or Advil or ibuprofen almost every day, maybe even twice a day. So it's kind of scary, but it's good to know.
I know so many people personally in my age group that are having fertility problems, and if that's been researched and confirmed, then I would lay off any over-the-counter pain medicines.
Dr. Kavusi says since it took 10 days for the anti-inflammatory painkillers to have a negative impact, it should be okay for women to take them for the first couple of days of their cycle. After that, he suggests switching to Tylenol. Not quite as good for pain, he says, but its chemical composition doesn't impact ovulation.
Good information for women out there.